Hello everyone, I welcome you to the course Introduction to Medical Humanities, and today we are going to talk about why and how do medical humanities matter in India. Before I begin with this particular topic, I want to emphasize on what we have done till now. Broadly speaking, we have taken up keywords that are important to be understood in the context of reading medical humanities. Additionally, we have taken up three major theorists who are foundational to the understanding of medical humanities. We began with Susan Sontag, followed it up with Arthur Kleinman, and finally took up Rita Sharon's work. Now, with this kind of a theoretical background, I want to now get into the most favorite part of what I call of this course and otherwise, which is why do we want to study medical humanities in India? Now, the core philosophy of medical humanities, where it merges humanities with the medical, I think it is very essential and becomes extremely relevant in the context of India. India, as such, we know, has immense amount of diversity, whether it is culinary, geographical, social, cultural, linguistic, so many we can quote in one go. In that capacity, how medicine is understood in different contexts, I think it plays a very vital role. And that's why when we discuss medical humanities in the context of India, it becomes not only a matter of study, but also a matter of national interest. Quickly, I will give you an overview what I will be doing. Very briefly, I will touch upon the definition of medical humanities all over again, and then go on to talk about impact of medical humanities in Indian healthcare, follow it up with government policies and other related campaigns that help us understand the core of medical humanities. Like I said earlier, medical humanities together takes into consideration medicine, health and humanities to better understand what health illness mean to people and communities. Now, when we think about healthcare policies and systems, these affect communities' well-being, encouraging more humane, reflective and socially responsive approach to medicine. Why then medical humanities matters in India? Like I said earlier, the quotient of diversity is extremely pertinent. But the understanding of medicine, because of diversity of India as well, cannot be just treated as biomedical. It must be socially responsive. India's diverse healthcare landscape, characterized by linguistic, cultural and regional differences, further highlights the need for such perspectives. Progressive institutional initiatives in medical education increasingly acknowledge the importance of integrating humanistic approaches alongside biomedical training. These aspects help future healthcare professionals to develop a more holistic and socially responsive understanding of patient care. Every person experiences illness differently, and these experiences are influenced by culture, language, identity, and social context. By paying attention to such narratives, medical humanities scholars can identify needs, concerns, and barriers that may remain invisible in purely biomedical data. These perspectives help healthcare providers understand the emotional and social dimensions of illness. As a result, many healthcare institutions increasingly recognize the value of narrative methods in medical training and practice. Listening to patient stories strengthens communication, builds empathy, and ultimately supports more patient-centered and compassionate healthcare. Let us take a few examples because I think to illustrate it further, some of the examples are a good idea. Most of the examples that I take are from Hindi because that is the language I am familiar with. But I am sure you can take this context into your language, and you will find narratives. And therefore, I'm using Hindi language examples. So please bear with me, but I'm also translating it in English for your reference. However, I would request you to look into your own examples at the same time, and you will find that what I am saying with my own examples actually can reflect on what you have also come across in your readings. So a patient, say for example in rural area, might only say dhadkan बढ़ रही है, which loosely translates as my heartbeat is increasing, or dil bhari lag raha hai, which is heart is heavy, to express their bodily symptoms. It is now up to the medical practitioner to deduce through further inquiry whether it is anxiety, stress, or any other cardiovascular disease. Miscommunication can lead to misdiagnosis. Now, when you integrate medical humanities into medical curriculum, this gap of how language can lead to a different kind of diagnosis is fostered, because when you bring in the element of narratives into the curriculum, it fosters emotional understanding, cultivating empathy through attention, representation and affiliation. The one that I discussing, Rita Sharon, the model that she talks about, where she mentions 3 important elements within the scope of medical humanities: attention, representation and affiliation. We can see that in the Indian context as well. To better understand this, I will take one more example that I have seen recently. So there was a web series called Perfect Family that I came across, and it is created by Palak Bambri, and we find that the child Dani Karkaria complains about constant stomachache. Her family classifies it as a ruse to escape school. But further up in the series, we realize that the stomachache was a manifestation of her mental stress caused due to the stressful environment at home. Thus, not just the communication, but effective communication helps in proper diagnosis of underlying causes. Medical humanities helps medical practitioners bridge this gap. Let us take another example of India's diversity, where we essentialize how and why narrative competence is important. If we look at India, 1.4 billion people approximately, 22 languages, 2,000 ethnic groups, different caste, religion shape the health scenario. To a certain extent, many kinds of food habits too. A tribal patient cannot explain the symptoms in Hindi or English. To understand their symptoms properly and to do proper diagnosis, one needs interpreters and cultural understanding. Medical humanities provides training for both, to interpret the language and to also follow up the cultural understanding. And that is why you will see that when medical practitioners or maybe I should rephrase, the health professionals across the country, India, whenever they are posted in that particular region, the first thing perhaps they learn after their service is the language in the region in which they are posted. Similarly, many of the women feel hesitant to reach out to doctors for their gynecological health issues due to the prevalent stigmas around them. Here, the community health workers like Asha and Anganwadi workers may act as vital connections between them and healthcare systems. They often use storytelling, personal narratives, and visual aids like flip books to communicate health information, build trust, and combat myths, serving as trusted community confidants. Despite the advanced medical infrastructure, many patients fail to complete their medicine course as prescribed by the physicians. The non-adherence to medicine leads to treatment failure, drug resistance, and other issues. Medical humanities helps in reducing this through better communication about dosage, building empathy and trust among the patients, aligning treatment according to cultural beliefs of patients. Now, in the Indian healthcare, medical humanities has increasingly impacted. And I will say this because I have analyzed quite a few policies, though I bring in very few here, but because this is an introductory course. But if you just quickly search on Google, you will find different healthcare policies across different states of India and also central government policies, which will indicate that there is definitely a humanities quotient that has shaped them for what they are. Institutional and governmental efforts have increasingly recognized the importance of integrating humanistic perspective into healthcare systems. Universities and research institutions worldwide have also contributed by establishing medical humanities programs that prepare healthcare professionals to engage with the social, ethical, and cultural dimensions of illness. At the national level, many health services and policy frameworks have begun incorporating patient-centered care and narrative-based approaches into medical training and hospital practices. The introduction of competency-based medical education, which is called CBME in 2019, guided by the National Medical Commission, is one such example. In this, the curriculum aims to integrate aspects of attitude, ethics, and communication into medical training. It will help doctors become not only clinically competent but also empathetic and socially aware. In addition, community health initiatives supported by government often rely on insights from social sciences and anthropology to better understand local health needs. Such efforts help design culturally responsive healthcare interventions and strengthen communication between medical professionals and communities. Some community health initiatives that integrate medical humanities are discussed in the next slide. Let us take it from here. I must emphasize that these are just some of the examples that I am showing. You can come across many policies that you can use as example, and you will find that they do reflect the element of medical humanities penetrated into it. The first one that I begin with is called the National Health Policy, NHP 2017, which aims to achieve universal health coverage and improve quality of life through preventive and promotive health care. It emphasizes ethics, professional standards, and equity. One of the major goals of this policy is the attainment of the highest possible level of health and well-being for all the ages. It moves beyond the purely biomedical model and integrates the idea of equity, dignity, and experiences of patients in its framework. The very famous, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, ABPMJ, is India's public health insurance scheme providing 5 lakh coverage per family annually for secondary or tertiary care to over 10.74 crore people and vulnerable families. It has recently expanded to include all residents aged 70 plus, regardless of income in its scheme. It provides cashless treatment to low-income families, tackling the economic realities of India, and addresses the vulnerability of the elderly by providing them an opportunity to live a dignified life. The final program that I discuss in this particular context is National Program for Palliative Care, NPPC, which aims to provide rational pain relief, and palliative care is the care required by the terminal cases of cancer, AIDS, etc. It requires alignment with the patient, family, and community and their support. Thus, a very good example of how medical humanities gets integrated in the Indian healthcare policies. India always, you will find that cultural narratives have dominated the understanding of national interest, and in this case, this merges with the health. And therefore, several slogans and advertisements become important not only from the government side, but also otherwise in day-to-day life. We come across many slogans and advertisements that are popular because they prioritize health. And when I say health, it's not just clinical. It is also about the change in public attitude. Some of it, again, like I said, you can take your own examples. I take some of that I know. We see that the medical humanities ensures empathetic and culturally relevant messaging. What is important? You might have seen that some people say that I am not going to endorse anything that is harmful to health. All these are part of awareness campaign. The very fact that these cases come up in the media is also a kind of an acknowledgement that it's an awareness regarding something that you could not take up on health. If you just quickly search on Google or maybe YouTube, you will find so many recipes around good food habits, so many channels around maintaining a healthy lifestyle in terms of exercise, walking, so all these are part of this whole idea where humanities should meet the medical. Let us take, for example, the slogan "Do Boond Zindagi Ki," that became the reflection of the nationwide campaign for pulse polio immunization program. The simplicity of the phrase combined with Amitabh Bachchan's, became the reason for the popularity of this campaign. So you see how a social cause with a national kind of a cultural icon blended to create an awareness. The slogan "Do Gaj Doori, Mask Hai Zaruri." So it is important to wear mask and maintain social distancing during the COVID-19 times. We had heard of this slogan. We have followed this slogan. And in fact, we have followed this slogan like it was most important thing at that point of time. It conveyed the message for social distancing in brief. And it was so easy to understand the language. I mean, somebody who was also not knowing the language would know what this means. It was crisp and easily understood by the public and suitable for multiple repetitions, reinforcing the idea of safety during COVID. There is another, slogan. You can see it here. It says, "TB harega, desh jeetega." Tuberculosis. If you look at the history of this particular disease in India, India has fought this disease with a lot of, campaigns. Of course, resources too, but also there has been a lot of campaigns around what is to be done, what is not to be done. In this context, you will find that the slogan "TB harega, desh jeetega." So the very element of bringing desh into the forefront if TB loses. So the idea of TB, tuberculosis, is personified and it is pitched against the nation. So as citizens of this country, the onus came to us. It was not just about healthcare professionals. The onus was led to the citizens of India. So what it did was, it encouraged the TB patients to get checked, take medicine, and complete the medicine course of the disease. These slogans came from the intersecting domain of medicine and humanities. In medical humanities, there are other ways also the issues related to health have been destigmatized. You can find that advertisement have also become a very mass awareness campaigns for the public. In 2018 particularly, the Union Ministry of Health and Family Welfare came up with anti-smoking ad featuring Akshay Kumar. I'm sure all of you know about Akshay Kumar. In this ad, Akshay Kumar questions the husband for smoking and suggests him to buy sanitary pads instead of cigarette. Now, this is one advertisement all of you must have seen. All those who are watching must have gone to cinema halls, I'm assuming, maybe. But I think even if you watch it on any other platform, you will always come across this particular ad. It's a very familiar image, and that's why I'm using it. So it was a very good idea, in fact, from the government side to use a campaign like this. And this ad focused on two health issues, if you can notice. One was indeed smoking, which was very visible. But there was another aspect also, which was around the menstrual hygiene. By bringing it up so publicly, the advertisement attempted to criticize smoking as well as counter the stigma associated with menstruation. This demonstrates how medical humanities uses media and advertisement to challenge stigma and promote healthcare beneficial attitudes. By encouraging open conversation around sensitive issues, it makes healthcare awareness more inclusive, more accessible, and socially impactful. Finally, to sum up, I can say that medical humanities provides an important framework for understanding healthcare beyond medical perspectives. As this lecture highlights, health and illness are deeply shaped by social structures, cultural beliefs, historical contexts, and lived experiences. In the Indian context, where diversity of language, culture, and healthcare practices is significant, such perspectives become particularly valuable. By emphasizing illness narratives, ethics, communication, and empathy, medical humanities in the Indian context emphasizes on more patient-centered approach and complements scientific medical training by fostering interdisciplinary thinking and deeper engagement with that of human dimension of care. Ultimately, the study of medical humanities contributes to developing healthcare professionals who are not only clinically competent but also socially aware. They are aware of what India needs from them, not only clinically, but also how other aspects of being can influence the clinical dimension. At this note, I will stop and take it up further in the next unit. We have now completed the 5 lectures of week 1 and laid the foundation of how we are going to take up medical humanities course in the context of India. Like I had said in my introduction itself, that there are 2 aspects that are foundational to this particular course. One, that at all point of time, it is going to be interdisciplinary and multidisciplinary in nature. Therefore, it is not towards just one subject. It takes up many disciplines into one pitch. And second, and most important rather, I take up most of my examples from India because the quotient of familiarity with the context is something I do not want to compromise on in this particular course. That is the intent and that is the content. Thank you so much.